It's a Sunday, and I think we're confessing. So there's like, so if we are confessing, and I'm going to be very honest now to the public, I have done it. At the end, just before finishing, there was just a little bit left. I'm finishing just the area of the tip, when all of a sudden, as I'm injecting, the whole nose becomes white. The next day, okay, I get a phone call.
You make me scared. Selamat siang semua. Hai, saya Dr. Astrid Harianto. Saya dermatologis dari Indonesia. Hari ini kita ada di Bali loh. Nah, saya mengikuti pertemuan ilmiah tahunan ke-20 Perdoski, disertai juga dengan Pan Asia Conference of Dermatology 2025 yang pertama. Nah, saya bekerja di Skin 101 Clinic dan Astrid Harianto Dermatologi. Nah, hari ini ada seseorang yang sangat-sangat spesial, yaitu please welcome Dr. Hassan Galadari dari Dubai, the famous one. First time, this is my story about Dr. Hassan. First time I met Dr. Hassan when I look and search his book about filler. I think it's back then like 7 years ago when I went to IMCAS Paris.
That's right.
And then when I took the book, and then you were standing next to me.
It was serendipity.
Yeah, it's serendipity. And then I asked him, "Can you please sign the book?" And I still have our picture in my Instagram until now.
Wow,
that's
fantastic.
my memory about Dr. Hassan. So today we're talking about collagen stimulator with Dr. Hassan Galadari. Could you please explain the brand? I like this brand so much, which is called Novuma.
Novuma, yes.
Yes.
So Novuma is a calcium hydroxylapatite, which is pretty much a biostimulator. And, we have to understand that, different materials that are injected come in different forms. The gold standard in the past was hyaluronic acid.
Yeah.
And I remember when I was a resident, my mentor used to tell me that you should only use hyaluronic acid, because hyaluronic acid is the gold standard, it's safer, you can always dissolve it if there's any problems. But there was always a problem with the effect of HAs, that it only was able to fill. Some people will mention that it can also stimulate a little bit of collagen, but it's not a biostimulator.
Yeah.
So we needed pretty much another material that will allow us to kind of stimulate collagen. And then you have the other section of all the different types of fillers, which were considered to be the biostimulatory fillers or agents. And one of them is calcium hydroxylapatite, in which one of the leading brands right now is Novuma. I can tell you, it's probably one of the, I would say, the fastest growing of all the brands. Yeah, so it's not the first. I'm going to say it's not the first, okay, but it's definitely one of the fastest growing internationally.
Okay, so what do you think about Novuma, different from other products in the market?
Are we trying to compare it with the calcium hydroxylapatite, or are we trying to compare it with other products?
First, with other calcium hydroxyapatite, and after that, with other collagen.
Well, I mean, I have to tell you, so as I mentioned, it is not the first one. Okay, so so it has come a little bit later on. The origin of the company that makes Novuma is Turkish, so it's from Virgin, which is a company that's based in Ankara. And I visited them. The nice thing about all the different products that I've used is that I like visiting their labs and their manufacturers. And I have to tell you, they run a very state-of-the-art kind of lab. So it's high-end, fantastic, in a very nice location in Turkey. And the product that they're able to produce is, I would consider it to be top-notch. How is it different from the other leading brand?
Yes.
I can tell you the leading brand is, I would say they're very comparable. So in terms of non-inferiority, they're pretty much the same. I would say there are a few differences when it comes to the actual material itself. And I can tell you in terms of biostimulation, because I've not used calcium hydroxylapatite as a filler these days. I mainly use it as a biostimulator. And for me, if you want to compare both of them, they're about the same. And Novuma can also have a slight edge. it's a little bit, I would say a little bit better just because of the way that it spreads. It spreads out differently than the leading brand. And that's the reason why I feel that it has a slight edge when it comes to biostimulation.
Do you have more explanation about the percentage of the calcium hydroxyapatite?
Everybody keeps on talking about this technicality, about the percentages
Yeah.
and so forth. I mean, we've always known that the way that calcium hydroxyapatite is kind of packaged is that 70% of the syringe is the carboxymethylcellulose gel, and then the other 30% is the actual microspheres. However, in terms of the actual percentage of the microspheres themselves, or based on the weight, it's usually anywhere between 45 to 55%. So it's a little bit different than that of the leading brand, but at the same time, it's also very comparable, which allows pretty much its spreadability, because it's the actual gel that provides the stiffness of the product. And for me, at least, the gel, I don't want to say useless, but it's redundant. I don't want the gel to be there. The gel is there just as a vehicle so my microspheres are able to work. So if I have microspheres that are there in a higher percentage that are easily to spread, then for me that's a plus. It's a positive.
That's the positive. So the more percentage, the more positive.
Yes, exactly.
Okay. So based on your experience also, what skin types or age group benefits from using Novuma?
Okay, so skin types, if we're talking about different Fitzpatrick skin types, anybody can basically benefit. So we're talking skin type 1 all the way to skin type 6. So even skin of color, such as us, it's completely safe to utilize it. So it's completely fine in that sense. In terms of the age group now, this is very important. A lot of social media has been pushing, for example, the biostimulation, or the new collagenesis agents for younger age groups. And I am completely against that. Because technically speaking, we only start losing collagen when we are above the age of 25. Every year we lose about 1%.
Yes.
So if you're 25 years of age, you don't need any biostimulation. So it's not really necessary for you. If you reach, for example, 50, you've lost about 25%. So at that stage, you would probably need it. So my recommendation for patients is you would need to lose at least about 10% until you start to be something to be replenished. So usually by the age, I would say, of 35, end of the late 30s, that's when they start. But that being said, it's different from different ethnic groups. So for example, people of skin types 1 or 2, the Caucasians, their signs of aging appears a little bit early.
Yes.
And they lose collagen a little bit earlier than, for example, patients of skin types 4 all the way to 6. So they may need to utilize it a little bit earlier than, for example, us. So you have to take that into consideration too.
Yeah. Because, a lot of social media, they withdraw everything. And sometimes in the younger patient, they also want to, use collagen stimulator.
And that is completely wrong. I mean, I think that's poor marketing, and it's done by the competition. I've noticed that. Yes, it's done by the competition, and they really want to market their product. And unfortunately, they're doing it for the wrong population.
As a transformative effect from Novuma, can you walk us through the different indications Novuma can be used for?
So you've got different ways in which you can utilize it. You've got the cosmetic aspect, and then you have the therapeutic aspect. So for me, at least, the cosmetic aspect of things is that any person who wants to take care of themselves, wants to make sure that they look pretty good, maintain, for example, youthfulness, radiance, luminosity of their skin, they can have it injected. I myself have it injected.
Me too.
So there you go. So that's how it tends to work out. So that's for the cosmetic aspect of things. But at the same time, we also have to understand that you're dealing with a material that is able to also be utilized for therapeutic aspects. For example, for patients with scars, like for example acne scars, you can definitely utilize it. There are patients, for example, with you can definitely use it, for example, with patients with connective tissue disease, such as, morphea, such as lupus. Of course, their disease is under control. So you can definitely utilize it there. And you would need something like this because it doesn't just fill, it's actually stimulating your own collagen. So there are different ways in which you can tackle these things.
Yeah. So how do you use Novuma? I mean, it can be used in the box. It's a thermal filler.
Yes.
And then collagen stimulator.
Yeah, so it has a dual effect. So, I mean, you could use it in its pure form as a filler. It's got, you know, quite good in terms of physiological properties to be utilized as a volumizing filler, especially, for example, in the areas around the cheeks. If you want to fill that area up, maybe also a little bit around the jawline, the chin, and so forth. So you can definitely do that. My personal point of view here is that the power of calcium hydroxylapatite and Novuma, it comes more with the biostimulation.
Okay.
So once you start doing that and using it for that, you actually get much better results than as just a regular filler. So, for example, I would do it either diluted or hyperdiluted, either with saline or maybe with lidocaine. Sometimes I also mix it up with a little bit of a non-cross-linked, HA. That definitely helps.
Okay. So, with your opinion, HA non-cross-link, have you ever combined it with non-cross-link? Because it's going to be very stiff.
So if it's cross-linked or non-cross-linked?
Cross-linked.
Oh, cross-linked, yes.
Yeah.
So you can combine it. As a matter of fact, the company itself, Burgeon, has a filler in which you can combine. It's called Calhydra. So Calhydra, there are two forms of Calhydra. There's one that is semi-cross-linked, and then there is one that is actually fully cross-linked, which is Calhydra Lift. So you can combine it with their filler. So that utilization, however, is more for a volumizing effect. So if you're using it, for example, in the cheeks and you want a volumizer, then you could combine it with your cross-linked HA.
Okay.
And that's good because remember, your CMC, the carboxymethyl cellulose, after about a month goes away.
Yeah.
So you need something that's there to be sustained. So the HA is the thing that will allow your filler to be there for a longer period of time because new collagenesis starts kicking in by week 6 or week 8. So if by week 4 you've lost the gel, there's going to be a dip. And a patient was going to go, like after a month, they go like, what happened? You know, I had volume and now it's gone.
Yeah.
Because the collagenesis has not yet peaked. So for those patients, combining it with a cross-linked HA works wonders.
What about for a scar? You mentioned before with scar. Which one is the best? Using combination with the cross-link or non-cross-link?
Non-cross-link.
Non-cross-link.
Non-cross-link. So yeah, if we're dealing with scars, especially if we're dealing with scars that are, you know, acne scars, for example, my area of injection is going to be slightly very superficial.
Okay.
And I would need to utilize it in its dilute form. So I would dilute it so that I can inject it in the superficial area so that I can get good results for it.
So you dilute it 1 to 2 and then combine it with HA non-cross-link? Or just the Novuma without?
No, just the Novuma.
Just the Novuma,
yeah, just the Novuma.
without HA?
Absolutely.
Okay.
But also, you see, everybody's a little bit different. So if a person comes in with just scarring, that's the way to do it. But sometimes a lot of patients, they come in with scars, but at the same time, they also have volume depletion. So patients with volume depletion, what I would do is that I will enhance the volume first. Okay, and you will see when the skin gets stretched because you have volume, the scars become less apparent.
Yeah.
So once that happens, you know, you're basically, it's like a balloon, you're stretching the balloon. You're filling it up with air. Once that happens, then you start injecting more superficially. So you inject deep first, and then you inject superficial after.
Okay. So you have some sort like an sparing agent to, you know, to make the fibrosis, it won't connect again with the...
Exactly. And the nice thing about Novuma is that it's very versatile. You know, you could use it in its pure form as a volumizer, as we mentioned earlier, so that will help. And then you can use it basically either dilute or even hyperdilute. Because if you hyperdilute it, you can do it for the neck in areas, for example, that you cannot even inject any fillers there.
Yeah.
And for the neck, it gives wonderful results.
Okay. So which area are not recommended using Novuma?
There are 3 major areas that I would say that are not recommended to be injected. one area would be, for me, as an absolute contraindication, is the area around the eyes.
Yeah.
So the tear troughs, definitely not recommended. Areas of perioral, so the mouth, definitely I would not recommend it.
Okay.
Some people do it, I would definitely not recommend. Please don't. Please don't. Okay. Then you have other areas that I consider more or less danger zones, and I would not recommend it. I know there are certain experts who do it, but in my, at least in my practice, I would say if you are a novice, don't do it. This will include, for example, the forehead. I would not recommend injecting that area, even though if you hyperdilute it, technically you still can. I would say don't. Okay. And then also in areas such as the nose.
Yeah.
Yeah. So I would also not recommend injecting that area there too.
Yeah. So what happens if someone forget to, mixing it up, and, you have to mix calcium hydroxyapatite in probably 20 or 250 passes. What happens if they don't do multiple passes when they're mixing it?
You don't get a homogeneous spread. So you need to kind of do it, at least 15 to 20 times so you can have a homogeneous material. As a matter of fact, I usually recommend that, so you're doing 15, 20 passes, then you bring it back to the original syringe, and then you inject. Now remember, you still have more in the area. So you're done with the injection. Once you go back to connect so that you can put more stuff in your original syringe, also mix. Okay, because you don't want it to sit there and allow it to precipitate. It's always much better to mix. So you mix it freshly, and then you go inject again to make sure that it's homogeneous.
So you're afraid it's going to have a lump or nodules if it's not going to be homogeneous,
Exactly,
right?
exactly. You want to make sure that it's as homogeneous as possible to allow the microspheres to be spread out as evenly as possible.
So any tips if someone make nodules?
So if the unlucky person who makes nodules, okay, don't freak out. Don't freak out. That's the most important thing. Don't freak out. Okay, because the worst, nodules can happen to anybody.
Yes.
It's happened to me.
It happened to me too.
There you go. So it can happen to anybody. But it's the difference between us and other professions is that we are able to take care of our patients.
Yes.
So I always see my patients usually after 2 weeks from my injection.
Okay.
And if there are any nodule formation, it usually appears during that time.
Okay.
The first couple of weeks. If there are nodules and I feel those nodules, then immediately I would bring in saline. I would inject the nodules with saline to make sure that I'm hyperdiluting it even further. Now that's why my way of doing it. Now, if you don't do it and the patient for some reason comes and sees you a few months after and there are nodules, you can try doing the same. However, remember, if you do it after a few months, there's definitely, the body has created a little bit of calcification around the nodule, so it becomes difficult to spread. So the magic, week, I would say, is to try to bring the patient back within 2 weeks, okay, so that you can have that injected. Now that being said, if the patient comes back after and you want to get rid of the nodule, you can always inject them with intralesional triamcinolone, for example. That will help soften up the nodule. Some people would also inject intralesional 5-FU, 5-fluorouracil. And interesting enough, I've never used this, but it's been published in the literature, is that you can also use STS, sodium thiosulfate, which is the same as the sclerotherapy. That is injected, that can also soften it up.
Wow, that's interesting. Unfortunately, in Indonesia, we don't have the 5-fluorouracil.
But do you have STS?
I don't.
For sclerotherapy?
We only use saline if there's
saline.
Yeah.
Saline is the most published in the literature, and for me at least, it's the safest and the least painful.
Yeah. So what about other area besides face and neck?
Where do I inject it?
Yeah, because some doctors, they perform it for buttocks.
Oh yes.
Yeah.
Yeah, I've done it for the buttocks. There's nothing wrong with it.
Yeah. How many boxes of Novuma based on the clinics of your patient if you want to make? Probably not like a Brazilian buttocks.
Okay.
But probably in this several area, probably a lateral area of the buttocks.
Sure.
It needs enhancement.
Now, you have to, first of all, you have to truly understand that you're not creating a Brazilian buttocks.
Yeah.
You're not adding too much volume. you're increasing tightness of the skin.
Okay.
You're making the skin a little bit thicker. You're making the buttocks being lifted up. Okay, so that's the whole point. If you want the area to have volume, then you would want to inject it as a filler, not with the calcium hydroxylate, but maybe an HA, for example. Okay, so but the calcium hydroxylapatite, the Novuma, would work more for skin tightness. My recommendation is to also dilute it. So you dilute it at 1:1.
1:1.
Okay, because the skin there is quite thick, so 1:1 is actually very good. And at the same time, you would require at least, to begin with, 2 boxes on each side.
2 boxes.
2, yes, at least. This is the beginning, okay? And never go beyond, I would say, 4 boxes on each side, because you don't want to put too much and without reassessing the patient back again to see what matter of new collagenesis they've developed.
Okay. So you can make transformation with Novuma not only for face and neck, but also for
so
body.
So the buttocks is one.
Yes.
We've published also using it for the knees.
Oh, that's interesting.
Yeah, so a lot of people, for example, who wear skirts or who wear anything, especially now during the summertime, we've got a beautiful place. We're sitting here. I don't know why we're sitting inside. We can go out on the beach. Okay, so they have a lot of wrinkling basically around the knees, and you can also do it around the knees. It's phenomenal. Now, it's very comparable to the same results that you have with, for example, radiofrequency in the old times. It's even actually better because you see that there is thickening of the actual dermis.
By the way, with the skin tightening effect with Novuma, how do you combine it with evidence-based device with radio frequency and everything? Do you go with the device first and then Novuma?
No, this is interesting because we're here in the Pit Perdowski, and I've asked at least 6 doctors what they would do, and I got probably 6 different answers.
I also have a mix and conception about that.
I'll tell you, most of them would say you do the injectable first, and then you would use the energy-based device after. Okay, that's what a lot of the people that I've talked to tell me to do. Okay, me personally, okay, I would probably use the energy device first. Okay, and that will basically kind of cause a little bit of dissipation of the, and then I would introduce my, the actual Novuma a little bit after, 2 weeks after. So that's the, so you could, for me, it's either way. The nice thing about it is that it is not an HA. No matter what device you're using, you're afraid with the HAs that you're degrading the actual HA.
Yes.
You're not degrading the microspheres. Okay, so you won't have any problems in that department.
That's the most interesting part of using Novuma as the collagen stimulator. You're not going to be afraid to combine it with your evidence-based device, right?
Absolutely.
So I have an interesting patient using for underarm, using radio frequency, and then I can put Novuma after that, right? For skin tightening.
For the underarm? Oh, for here?
Yeah.
For the arms, yes. Yeah, for sure. Yeah. So it's been used here. As I mentioned, it's been used in the knees. I've used it also for patients with post-liposuction. So they've had, for example, liposuction done, especially in the areas of the abdomen, and they have wrinkling, for example, of the abdomen. You can definitely use it over there, and you can really change the shape of their the umbilicus. Okay, so that you can basically kind of move it around because you're actually kind of augmenting the area of that abdomen.
Sometimes after liposuction, there irregularity, right? Some kind of bump, so you can make it more
regular, you finesse it with your calcium hydroxylapatite.
So how about stretch mark and cellulite?
You can still use it.
Yeah.
So you can definitely use them. First of all, stretch marks. First of all, there's no treatment for stretch marks. Okay. I'm sorry. Okay, you can make them look better, but they're not going to go away. Okay, but you can definitely use the Novuma there. For the dilution there, it is usually a little bit more hyper dilute, so I would use 1 to 2, just because the skin is quite thin in those stretch marks. So I usually use 1 to 2 for those areas. So for stretch marks, it can be used. As for the
Cellulite?
cellulite,
Yeah.
now remember, cellulite is one of the secondary female sexual characteristics. This is a very common thing, mainly with females, not usually with males. So you can also use Novuma into that area. Now, also in combination, of course, with other treatments. For example, if you're using your radiofrequency, if you can use, for example, your HIFU, it can also help in that area there too.
Based on your experience, Dr. Hassan, what is the maximum dilutions when you use Novuma?
So I can tell you, when I first started diluting it, this was before the consensus came out. There was a published consensus that came out a few years ago, but we've been diluting it before, and we've been trying. We thought that depending on the skin type, we would dilute accordingly. For example, if the person has very atrophic skin, we would hyper dilute by anywhere between 1 to 5, sometimes even 1 to 6.
Wow.
Yeah,
Okay.
but what happened is that we thought this was okay. It was safe. There was no complications, but we did not see good results.
You don't see the biostimulator.
The biostimulation. It becomes too dilute. Okay, what's happening is that you're spreading the microspheres so much apart from each other that you're not getting a good enough biostimulation. So for me now, it has always been, I will go up to 1 to 3, but never beyond that.
Never beyond 1 to 3.
1 to 3.
That's the crucial.
Yes, if you go beyond, you're just losing that effect. Yeah.
Because there's some sort of a trend
I know,
using
I've heard.
collagen stimulator for your tear trough, under eye, but hyper diluted.
Oh, okay.
So give us your opinion about that. Now you're thinking.
It's a Sunday, and I think we're confessing. So there's like
because sometimes many doctors, they want to play with the product. Sometimes probably even though the evidence based and scientific rules say something like this, they just want to play with the product. So probably you just give us the proper guidelines how to use.
Okay, all right. So we tell our patients, or we tell ourselves, we tell our doctors, is that you don't do that area.
Yes,
okay.
me
However,
personally,
yes. So usually I don't. But however, there are certain occasions in which you can. Okay, depending on your expertise, and but it's never there to be taught.
Yeah.
So it's never there to be made public. Okay. You could do them in your own practice, but at the same time, you know your level of expertise and your level of comfort. If you're comfortable doing it and you've had great sustained results, that's fine. You can do it, but you have to be able to take responsibility if there's any complication that tends to happen. Okay, don't go and teach it, and then if a complication happens, then it's the other person's fault. It's your fault for teaching them that.
Yeah.
So if we are confessing, and I'm going to be very honest now to the public, I have done it. And
really?
yes, I have done it. I have hyper diluted it even further to be injected into the area around the eyes.
Using cannula?
With a cannula, of course. Yeah, with a cannula, not with a needle, with a cannula. Now, have I seen good results? The results are good, but I can actually see better results with other modalities.
Okay.
So my recommendation, it's all a benefit versus risk.
Yes.
Okay, so the risk there is much higher than the benefit. So I would rather use something else in that area to get the best results that has a much less risk, and to take into consideration. For example, your polynucleotides.
Yeah.
They're much better to be used in that area.
My personal opinion also, as a Novuma KOL, I don't recommend it also for teardrop and under eye. I want to sleep better. I want to sleep nicely at night. So I don't use Novuma for
I'm glad. Yeah.
Okay, so for cheek and then also for enhancement and volumizing for cheek, do you use sharp needle first as like 0 point something, and then after that you do cannula?
No, I'm a cannula guy. Yeah, the only place I would use a needle is, for example, if I'm using it at the temples.
Okay.
And I would use a gunshot technique, and I would inject it that way.
Yeah.
But most of the time, and also, I always say there's only one place. No, but there's many places. For example, if I'm doing the angle of the jaw. Then I would also use a needle here. So I like using the needles mainly here and here in the temples if I'm going to use that.
For the mandible.
For the mandible, yes, exactly. But most of the time I would use a cannula.
Okay. Yeah. The cannula is 25 or 23? Which one is your preference?
So anything above 25 is fine. So 25, 23, 22 is good.
Okay.
Yeah, but I like the 25 just because that... it doesn't come out splurging. Okay, so it gives me better control. So the 25 for me is good. You can use a 22 gauge, but remember, if you hyperdilute and you're using a 22 gauge, you have to be very careful not to push too hard, and then everything comes out.
Any tips for the gunshot technique for the tempora? Because many doctors are still using the 27 needle G.
Oh, 27, no. The 27 is so small, it's quite short. So I use a 25 gauge needle, and it's a little longer.
Yeah.
And the whole point is that you have to touch the bone. The 27 sometimes is too short, you can't touch the bone.
Yeah.
And they will say like, it's too short, I can't reach the bone. Then don't inject. If you don't reach the bone, okay, it doesn't mean that you have to inject. You're not married to your syringe, okay? Okay, so don't inject. Okay, so you make sure is to change it, put in a 25 gauge needle, touch the bone, and that's the area in which you would want to inject.
Even though some injectors said you can push the 27G needle, no, you're still not going to reach the bone, right?
So I've seen this happen actually. There was a person who was pushing so that they can touch the bone. They were really pushing very, very hard. And then they aspirated and they aspirated blood.
Oh, okay.
So what they were doing is that the 27 gauge is, it stops still here.
Yeah.
There's a vessel here. The bone is in the back. So what they were doing is that they were pushing, and they were just pushing against the blood vessel on the bone. And they thought that they were basically there, and they were entering inside the vessel. So don't do that. It's much safer. And if you want to sleep at night, okay? If you want to sleep at night, apparently you do, okay? Use a 25 gauge needle. That's long.
What about technique for, sharp to the bone for nasolabial fold using Novuma?
For the piriform fossa? Yeah, you could use that. If you're injecting the piriform, so for me, the piriform fossa is especially here in Indonesia because the morphology is a little bit different.
Yeah.
So the face is a little bit more on the roundish side. So you would, if you want that lifting effect, if you would only inject this part, the cheeks, to make a lifting effect, you don't get good results. You're making the face even rounder. So the best way to achieve that is to come with your Novuma to the piriform fossa, touch the bone just on the fossa itself, which is right over here, go deep, touch the bone, and then inject the bolus. And then you will notice that it will provide a lift without injecting the cheeks. So there's no volume here, but there will be a lift. And at the same time, there will also be a lift of the nasolabial folds with one injection just into that area.
With no dilutions?
With no dilution.
With no dilution.
Yeah, with no dilution. No, you don't want to dilute there. You want that lifting capacity to happen.
And then after that, are you going to, add with the cannula technique, just like, fanning technique in the line of the nasolabial?
Yeah, you mean in the nasolabial folds? Yeah, I mean, if the patient needs it, then yes. Remember, the patients and also doctors always make this error that they want to get rid of the nasolabial fold.
Yeah.
We are humans. Okay, monkeys don't have nasolabial folds, but humans should have a nasolabial fold. Okay, so we're softening up the nasolabial fold. We don't make it disappear. We're not erasing it. Okay, so we just soften it up.
See, softening up.
Exactly.
Not going to make it all disappear, right?
Absolutely.
Even children, they also have,
Exactly.
Yeah.
Children, and this drives me crazy. People want to get rid of the nasolabial folds. Not only this, they want to get rid of the lines that they have here.
Yeah.
This is normal. If you look at babies who are like 2 or 3 months, they have these lines, and they consider them to be cute. It's fine.
So also for the chin, for transformation.
Of the chin?
Yeah, chin area. Are you going to use it bolus?
Yeah. So, for example, if it's a male chin,
Yeah.
okay, because a male chin is different than
Yes.
female chin. So if it's a male chin, okay, so if it's a male chin, you want to make sure that it's more squarish.
Yeah.
So you would take in a line from the oral commissures downwards, and you would basically augment this area here to make it more square. And I would not dilute. I would use it in its pure form.
As a
Yes,
pure form?
in its pure form.
Using cannula and make it squarish, right?
Absolutely. Like this.
What about for female patient?
If it's a female patient, then you want to make sure that it's more round.
Yeah.
Okay, so you're going in the center because you're looking not at the oral commissures, you're looking at the ala of the nose, which is basically right over here. You go downwards, and that's the area in which you would want to inject. Now, that being said, when you inject it in a bolus, you're making sure that you're injecting it in a mound, a hill, not a mountain. Okay? So don't inject your bolus and then you make the chin too long. Then she looks like a cast from Wicked. Okay, we don't want that. Okay, the last thing you make her green and she looks like the Wicked Witch of the West. Okay, so you don't do that. Okay.
Well, lots of patient wants to have like a wicked, but not now. But
Yeah, thank God. Okay, so you inject your bolus a very small amount. I would say maybe 0.2, 0.3,
0.3.
and then around it you also inject to make it not just doesn't stand up. You make it more flat. So it's like a hill, not a mountain, a hill.
Okay.
Yeah.
So what about combination using HA crosslink for a chin enhancement? So you put Novuma, bolus 0.2, like you said before, and then for the volume augmentation, you can use also HA at the same time?
You could, but then my way of doing it is that I would do it the opposite. So I would use my cross-linked HA because now we've got really very good cross-linked HAs. They're very thick. Okay, as a matter of fact, some of them are as comparable as that of Novuma when it comes to urological properties. So I would use the HA to provide the structure.
Yeah.
Okay, and then I would dilute or hyperdilute my Novuma, and then I would be able to treat the chin on a superficial layer.
That's interesting.
Yes, so that's what I would do. Yes.
So now, this is going to be very interesting. The comparison between any other collagen stimulator, the PLLE,
Yeah.
PDLA, and also PCL. Probably you could describe, the differentiation between these collagen stimulators.
So we've actually looked this up and we've published it a few years ago in the International Journal of Dermatology. I was one of the authors. Is that we looked at the literature and we looked at the collagenesis of all the different the four major types. We took polycaprolactone, polyalactic acid, calcium hydroxylapatite, and hyaluronic acid. And we looked at the literature and we saw which one had the most new collagenesis. So if we look at polyalactic acid, polyalactic acid has the strongest inflammatory process. So when it comes to the inflammation or the foreign body response, polyalactic acid had the most. Okay, and it makes sense because if you look at the actual shape of the particles, they're not round. Okay, some of them are like a sharp needle, some of them are round, some of them are jaggedy edge. So that's polyalactic acid. Polyalactic acid never provides you with volume. There's no volume whatsoever in that area. So you don't get that. So that's the new collagenesis there. Then we looked at polycaprolactone. Polycaprolactone was a great volumizer. Okay, so you get the new collagenesis and you get good volumization. Okay, but so that's basically how it tends to work out. Then we looked at calcium hydroxylapatite. Calcium hydroxylapatite, based on the literature, was the most versatile because you can inject it in the pure form, and then you can hyperdilute it. So the literature had both dilution, hyperdilution effects, and also in the pure form effect. Okay. So most of the literature would point out that about 50% of the volumizing effect, if you're using it as a volumizer, is lost in the first month, which makes sense because of the carboxymethylcellulose.
Yeah.
But in terms of the inflammatory process, it is much less compared to polyalactic acid. So with people, for example, who are using polyalactic acid, they should expect more swelling to happen if they get that. Okay? With the calcium hydroxylapatite, you don't get that. And then finally, hyaluronic acid, you get some form of biostimulation, but it's not more than 3 months. and then goes away.
Never more than 3 months.
Never more than 3 months.
Because lots of patients, they ask about, can you booster the collagen stimulator? Because, you know, other collagen stimulator, they hyperdiluted and then they put it in the syringe using needle and using like a skin booster. Yeah.
Oh, you mean superficially?
Yeah.
Oh no, that's crazy. Yeah, no, I'm sorry. Yeah, so I mean, I would never use it very superficial. No, it's just that there are microspheres that are there, and the microspheres should be more on the deeper side. So they should be placed, you know, at least if you were going to place them in the dermis, they have to be placed in the deep dermis, or you know, the upper subcutaneous tissue. So subdermally, the upper subdermis. And that's where I would place it. If you go very superficial, you're just basically asking for problems to happen.
Yeah. Probably sometimes it can make calcification or nodules.
For sure. For sure. Because remember, you know, in the hyperdilution effect, you want spreadability. If you are in the dermis, you're not going to be able to spread. You know, things are stuck in the dermis. You see what I'm saying?
Yeah.
Yeah, because, you know, the dermis itself is very dense. There's a lot of collagen in there. If you want spreadability, you have to be just underneath it in the subcutaneous tissue. That's where you can massage your material to be spread out evenly.
So any tips for chubby patients?
Chubby patients?
Yes, using Novuma. Sometimes you know, us as an injectors, okay, this one is, you know, like a hypertrophic patients. Like me, I think I'm a normal to atrophic, so I can, you know, put lots of injectables to my face. But for patient with a chubby cheek, you know, how do you use Novuma in this sort of patients?
So for those patients, I don't like the word chubby, okay?
Yeah, okay.
All right? I would say round face.
Okay, round face. My bad, my mistake.
So for patients with round faces or round face morphology, you can use it in its hyperdilute form, because what you're doing is that you're just simply causing biostimulation and rejuvenation of the face, not really adding too much volume. So in that sense, you can definitely use it. You can use it as a filler to break off the roundedness. For example, if the person is quite rounded, you can add a little bit of more augmentation in the chin to make it more oval. So that will kind of break the round mold. So that's where you would do it, and if it's going to be in a filler kind of way.
Okay. Yeah. So for jawline enhancement, the difference between male and female using Novuma, with your preference. What's the technique?
It depends on the angle.
Okay.
Now you have to understand that men are never right. They're never right. Okay. Women are always right, with the exception of the angle of the jaw. Okay. The angle of the jaw is a right angle. Is more of a right angle. So 90 degrees to 100 degrees in men. Okay. So that's why they have a sharp edge. While in women, it has to be more obtuse. Okay, so it's about 120 to 130.
120.
Okay?
Okay.
Yes.
Okay.
Only when it comes to augmentation of the jawline. That's it. But everything else, women are always right.
So the dilution for
no dilution.
No dilution.
No dilution here. No.
Oh,
no.
okay. Okay. So the key points of Novuma is the transformative result, using Novuma not only for face and neck, but also for body. So what do you think? How does Novuma fit into the aesthetic trends of 2025?
I tell you, so I've been using calcium hydroxylapatite for over the past 20 years. And I've seen it go up and down. So when I first started my training, it was HA. And then calcium hydroxylapatite was becoming the craze, okay, because our HAs back then, we're talking about the early 2000s, the HAs that we had were not really very good, okay? We only had maybe 2 or 3 types, okay? And they were not really very good when it comes to certain parts of the face. For example, the jawline, the chin, the HAs there were very poor, okay? Then there was a lot of technology that came with the HA that allowed the HA to be thicker, to be more stiff, to give us much sharper effects. So we've then, calcium hydroxylapatite usage has gone down, and then the HA has gone up. So that was, I would say, in 2010, going all the way till about 2000 and before 2020. after COVID, okay, apparently people, because they keep on seeing themselves on Zoom all the time, saw that their faces were very round and they just didn't look very good, okay? And then they just were afraid of using fillers. So HAs now have gone down and biostimulation or rejuvenation is going up. So now we're starting back again to using the calcium hydroxylapatite such as Novuma in the dilute, hyperdilute form to be able to achieve that. So it's always been going up and down, and now I've seen a huge resurgence of biostimulatory agents, in which Novuma is one of them. And I would say, in my practice, now it's reached, if not 50-50, it's a little bit higher than, I would say 60-40, in terms of people wanting to have Novuma done more than their HA.
There's, a trend, higher trend with the collagen stimulator using Novuma rather than filler right now.
Exactly. I mean, and the fillers would only be placed now in certain areas. For example, the lips. You know, you can't do anything except for, an HA. So for the lips, yes.
This is interesting part also. What about the off-label using calcium hydroxyapatite for nose enhancement?
Okay, so this is off-label, and remember I told you we've been doing, I've been doing it at least for over the past 20 years. So there was nothing that was really very good for the nose.
Okay.
And the HAs were not really very good for that area. So I used a lot of calcium hydroxylapatite for the nose in the beginning. Then I had one patient, and that patient basically kind of made me fear God. This is a patient who came to me, and this is like confession now. It's like, this is a patient who came to me, and she traveled from Saudi Arabia. Now I live in Dubai, and Saudi Arabia is about 2 hours away by flight. So she flew in. Apparently, she saw me on YouTube and social media or whatever. And she said like, I need to see you because you're really very good. I've seen the way that you do noses. I want you to do my nose.
Okay.
So she came to me, and then I looked at her nose, and I'm going like, her nose it's okay. There's a little bit of a divot. Definitely had a rhinoplasty. And I asked her, how many rhinoplasties have you had?
Oh, wow.
She tells me I've had 3. I'm going, that's a red flag. Okay, so that's a complete red flag. If you have a patient with 3 rhinoplasties, tell the patient, go back home. Okay, so that's what I said. I told her, you don't need anything because you're afraid of a patient who's probably has some form of body dysmorphic disorder. She's not really very happy with her nose. Okay, so I tried telling her not do anything, but she insisted. And given the fact that she was a woman, I'm a guy, she boosts up your ego. Okay, this is what happened. It's a true story. Okay, so I felt that I was pushed into doing something.
Oh, okay.
And I did. So I usually inject the nose, and at that stage I injected them with calcium hydroxylapatite, and I use a cannula to be on the safe side. I've always used a cannula. So I'm coming into the nose with my cannula, and then, of course, my cannula does not go in.
Because of the fibrotic and probably the neovascularization after rhinoplasty, right?
Absolutely, you got it right. So that's the thing. So this is red flag number 2. Okay.
If you cannot push the cannula,
you cannot push the cannula. Don't do it.
Don't do it.
Don't do it. But the thing is, she really boosted up my ego, and I said, she came and she flew all the way from very far away. I need to do something for her. So I removed the cannula and I put a needle, of course. And the needle, of course, is able to go through anything. Okay, so
is it 25?
It was a 25 gauge needle. Okay, so I go in with a 25 gauge needle, and it's going in very nicely. And I'm looking at her, and I'm going like, wow, she's right. I am very good. Because I was seeing really fantastic results as I'm injecting. And then at the end, just before finishing, and there was just a little bit left, I'm finishing just the area of the tip, when all of a sudden, as I'm injecting, whoosh, the whole nose becomes white.
Oh.
And I'm going like, oh my God, what did I do? Okay, and it became white. It became super white. And you can tell that I've definitely hit a vessel there.
Okay.
A vessel that should not be there because I'm always in the middle. Okay, but because of the rhinoplasties, it's there now. I immediately stopped. I put the, the needle there. I was like sweating, feeling very, very, very afraid. Okay.
Okay.
I asked the nurse to go and get me some warm compresses. Okay. Also gets a little bit of saline because we want to try to flush it as much as we can. And then I started massaging. I kept on massaging, putting the warm compresses. I was able to see that there was at least some color coming back.
Okay.
Okay, and I felt at ease at that time, but then I was still afraid. I mean, like, this happened in front of you. Is it going to have sequelae if the patient leaves? And I thought to myself, okay, at least she feels good right now. And she asked me, like, why are you doing too much massaging? I told her this is normal. We do too much massaging because I didn't want to tell her that we've caused an embolism or a vascular compromise. I want to take care of her first. So I do that. The color is back. Everything looks good, at least to my knowledge. And I stay with that patient for a good 30 minutes to make sure that the skin was okay. It didn't go back again to being white. She leaves. The next day, okay, I get a phone call.
You make me scared.
Yeah, you see, I wanted to sleep. I did not sleep that day. So the next day I get a call from Saudi Arabia. I'm going like, oh my God, it's a Saudi number. So I'm going like, oh my God, it's the patient. And then I pick up the phone and I tell her like, so are you okay? Because it was her.
Okay.
I was afraid that she was calling because she was complaining of like maybe tenderness or maybe something happened or maybe her nose fell. and she tells me like, Doc, I have to tell you, I wanted to thank you. I'm going like, okay. I wanted to thank you because I had the best night ever. I tell her like, why? What do you say? I think it's because of the massaging that you gave me. I feel my sinuses have opened. I'm going like, thank God. as long as like she's okay, this was but for me, this was the last time I've injected calcium hydroxylapatite in the nose. I've stopped injecting it in the nose since then.
But thank you for being honest. I mean, we learned.
Only from you, only because it's you, Astrid. I felt so comfortable that I could tell you my stories.
Because sometimes, sometimes all doctors, they only share good experience. I did this, the result was amazing but I think as a doctor, we also need to learn from our, from other experience, other mistakes, because we can learn and progress from that, right?
The minute you think that you are beyond any mistakes, I think you've lost it.
Okay.
Yeah, you have to make mistakes. That's the only way to learn. You have to fail. That's the only way to learn. The difference, however, is that we are able to recognize our mistakes and learn from them to correct our path. Okay, so that's the whole point. But if you start saying that you've never had any mistakes done, I can tell you probably have never practiced.
Because complication is 1 to, 10, 1,000 or probably more than that. If you never make mistakes, probably
you're not practicing. You're definitely not practicing. I mean, I've definitely had complications, a lot of them.
So with that patient, may I know which, and you have lots of entry point? The injection point, you have lots of injections?
For that patient?
Yeah, for that patient.
With the needle?
With the needle.
It was 2. So there was one that was pretty much a little bit more on the proximal side to treat this part. And then there was a distal one. And so it's the distal one that caused the problem.
That's the end artery. There's no anastomosis.
Yes, exactly. That was the one that caused the problem at the end. Yeah.
So with the needle, you put how many millimeters probably? Not 4? The depth of the needle. You probably forgot about it.
I mean, it was pretty much more on the superficial side. So what I usually do is that I hold and then I'm injecting. So I'm a little bit just subdermal. Okay, but it is quite superficial at the same time.
And then you flush it with the same needle with the saline.
Yes, with
everywhere.
saline. Absolutely. Yes. And then there was massage, and the massage is not massaged like this. It's actually massaged from the side. Because remember, the blood vessels for the nose are coming from the side, so you want to make sure that you're pushing the blood coming into the sides into the middle part. Yeah.
Wow. What an experience.
It was a humbling experience.
Yeah.
Because, and this tells you, I mean, patients are always going to come and they will try to manipulate you. They will tell you that
Yeah,
you're
yeah,
a fantastic doctor, you're great, you're number one, and so forth, just so that that you can do something that maybe other doctors will not want to do.
Okay. It's a great, it's a great experience that you share to us.
You're welcome.
Yeah. I mean, not many doctors want to share.
Oh, no. Yeah, we have to learn from our mistakes. Yeah.
Yeah. Have you ever put it in the glabella?
No.
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 I'm confessing, but I can confess that I have not had it done. I've never injected the glabella. No.
Okay. I'm just curious. So with the columella, also no, or only?
No, only the dorsal aspect, not the columella. No.
Not the columella.
Not that I know.
Okay. Do you have any more experience that off-label using Novuma?
No, I mean, I could tell you, I mean, it's a very versatile, very safe product. If it's used in the right hands, the right patient, you get great results.
Yeah.
And for me, it's life-changing because, and we're talking, the theme is transformative, and I think it is something like that because you can definitely change a person's outlook.
Yeah.
You can make them feel more confident in their own skin. If they start feeling that as they get a little bit older, their face is sunken in, they're losing their luminosity, their radiance of their skin, you inject a little bit of Novuma, you provide that a little bit of a lift, they shine a little bit more.
Yeah.
You wake up in the morning, you look at yourself in the mirror, you look good. And when you look good, you feel good. And when you feel good, you're able to function as a productive member of society. And it's important. People will say, oh, this is so vain, it's vanity and so forth. But it's true. The way that we look really plays a huge role in our psychological well-being. So we have to make sure that we take care of our patients that way. We have to make them look natural.
Yeah.
Okay, not cartoons, natural, so that they can look actually good when they see themselves in the mirror.
Yeah. What about for hand? For
the hands.
Hand rejuvenation.
Oh, I love.
You haven't mentioned.
We haven't mentioned hands, but because for me, I mean, hands is a no-brainer. I prefer Novuma calcium hydroxylapatite beyond anything like an HA for the hands. So I will definitely use it on the dorsal side of the hands. I would never inject the digits, but the hands for sure. And I would use a cannula.
Use cannula.
And 1-to-1.
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 If you mix it with the HA crosslink.
I wouldn't do it. It'd be too much, too much volumizing. So, I mean, you could use it with a non-cross-linked one, or you could just simply use it just normally.
Oh, okay. Maximum Novuma boxes for face, because sometimes us as an injector, we're afraid of edema, the swelling of the product. The maximum product using?
I would say a good amount would be 3. 3, maybe 4, but
4.
Yeah, but it's not. When I say 3, we're talking about the whole face.
Yeah.
So it'll be 1 syringe here for the cheeks, 1 syringe here, and then probably another 1 syringe for the jawline if you're going to do it, and another syringe for the jawline. So maximum 4.
Maximum 4.
And if you're going to need more than that, don't. Okay, do 4. Have the patient come back and see you in a few weeks, and then inject more after.
I think it's going to be end of the podcast.
Well, it's been wonderful talking to you.
Wow, it's been wonderful because I look up so much to you. So the way you share your experience, everything, it's mind blowing for me, and also mind blowing for any other doctors.
I'm glad.
Yeah.
I mean, people have to relate.
Yeah.
Yeah, but I can't tell. Just because people think that, oh, I'm a KOL and so forth, it doesn't mean that I have never made mistakes.
Yeah.
So, I mean, you have to relate to certain people. So, I mean, I hope that you've related to the problems that I've faced.
I'm really relate, and I also feel the transformation effect using Novuma, because you can do it in certain ways as an anti-aging effect, for scar also, and don't forget for stretch mark.
Yes.
Yeah, and for cellulite. And you also, I mean, we're in Bali, so probably we can also put in the décolletage area,
absolutely.
Right?
Yes, for sure.
Yeah. With the hyperdilution.
With the hyperdilute, of course.
1 to 2?
1 to 2.
1 to 2.
Yeah, 1 to 2. Remember, because the skin is not just thin here; there's bone.
Yeah.
So you want to make sure that it spreads nicely.
And don't forget, not more than 1 to 3, right?
Yes.
The delusions.
Absolutely.
Okay. So this is the end of our session. So I would like to thank you to our famous Dr. Hassan Galadari and also Radian Elok Distriversa and for Sofitel Hotel in Bali for providing us these beautiful sessions for this afternoon. See you in the next session. Thank you very much.
Thank you.